This is January 29th, I think. I could barely talk. I have this incredible headache. I'm missing class. Civil procedure. I just wanted to make a recording because 2 days ago I was confronted by Dean Gustafson at Bowen School of Law, where I attend. And I think I'm, if not the highest, one of the highest LSAT scores that got in there. I'm not doing that great, though, grade-wise. And I'm not really certain if it's me or if it's them. But Dean Gustafson warned me that she had gotten some, it sounds like the order, and I haven't looked in the file yet. I'm going to go do that. I think on Monday or Tuesday, something like that. I have an appointment set up to go look in the file and see if they put in there who transmitted it. But I think what it's going to be is the order from the Arkansas Claims Commission, where they were asked to put the claim in abeyance, which means just basically a stay until we could go after the insurance money that might cover the damages that were caused by a whole slew of medical personnel at UAMS. Just right now, I'll throw off a couple names if I could remember any. Dr. Joseph Margolick, Dr. Natalie Applebaum, Dr. Benjamin Davis, Dr. Elizabeth Brown. These people had, anyways, I'm digressing. We have a case against them, my son and I. And for when they battered him and they held him, they imprisoned him without any lawful reason. And they kept him for 2 weeks, and I spent the 2 weeks trying to get him out. So now we're co-claimants and co-plaintiffs, and the Claims Commission was supposed to decide if they agreed to put this case in abeyance, and they said yes. That was fine. Oh, and by the way, second paragraph, we're concerned that Laura is committing the unlawful, unauthorized practice of law. That would be a misdemeanor with the potential of a year in jail for me. But what Dean Gustafson let me know is that if I am practicing law without a license, that's going to be something that might get the give them an objective reason to deny me a license. Well, I let her know that I'm not practicing law unauthorized. But, you know, it's clear that these medical personnel committed crimes against my son. Undoubtedly. I mean, there's just no, it's so clear that I'm willing to sit here and post it on the internet. And I know that other than how corrupt our legal system is, that there's no way in the world that I could be found liable for any kind of defamation, because it's so true. It's completely 100% true. They, against his consent, forced him to use fentanyl, which killed I think it's the governor of Arkansas, whose brother died from one dose of fentanyl. I know I have a son who died from one dose of methadone. So I know that they shouldn't have been giving my other son fentanyl, but they did. And then they gave him, within 23 hours, they gave him lorazepam, diazepam, propranolol, fentanyl, I think a barbiturate, anyways, however you say that word. Keppra. Lots of Tylenol. So that's actually what spurred me to make this video, is that my head hurts so bad. I took a half a extra strength Tylenol, and I just took a quarter of 0.5 milligram clonazepam. And I'm thinking, they were giving my son all this anxiety medication when he had a traumatic brain injury. And it's actually contraindicated for TBIs. And a couple people, including nurse Susan Zaleski, she got married now, it looks like. She's got some other last name, but she said, we'd never give TBIs, give benzos to TBIs. She was absolutely certain about it. So, well, now I see how anxiety causes headaches. Now, I'm so anxious about being told that, I might go to jail, I might not get my license even after I go through the program. 3 years of hard work to get my license. I passed the bar. They still might not give it to me. And this isn't just any 3 years. It's not like I'm 25. This is 3 years where I have about 10 good years left in me, because I'm 63 years old. So, I could just be sitting there looking out the window. It's very pretty today. I'll see if you could see. This was Snowmageddon. We're snowed in. Actually, now it's very pretty out. It's not even that cold, but there's still ice on the road. So, yeah, I'm just thinking, it didn't make any sense at all that they have someone in there whose only problem, he came in on an emergency ambulance, and his only problem was that he had hit his head and there were some stable bleeds. They weren't still bleeding. And fractures in his head. Some of them were already there. They were from past accidents he's had. So they get a patient whose only problem was this headache, or not, he even didn't complain about a headache. He said it hurt a little, but a head injury. And they caused him so much anxiety that even in a normal situation, like a otherwise perfectly healthy person who has that much anxiety is going to get a headache, which is exactly the worst thing that they could have done to him. And the other thing is, and this is kind of maybe controversial, and I don't want to sound like I'm practicing medicine without a license, but we were allowed to do what we thought best for him at home, as long as we didn't give him prescription medicines. We could have given him homeopathic cures. We could have had someone come in and do acupuncture. We could have had someone come in and give him reflexology. I could have just given him reflexology. I cannot sit up. I mean, I'm missing my class right now. I'll take it later. I could watch the video. But I could have been in class right now. And all I'd have to do is sit there. Wouldn't have to say a word. She doesn't know if I'm thinking or not thinking. I could have just sat there, stared at the screen. But my head hurts so bad that I cannot sit up. I am using a pillow. But so they didn't let my son lay down at all. They always had him propped up, which I kind of understand, like if he had an injury to his head, you don't want it to... It's just like any injury you have, if you've got a sprained ankle, you raise it up. My dad was an orthopedic surgeon, and he used to have us raise our injuries. So, I don't think that was like necessarily the worst thing, but I think it would have been up to him to decide if, he would have been more comfortable laying down. Especially if the headache wasn't caused by the head injury, but it was caused by the anxiety that they were creating by imprisoning him. And when I say imprisoning him, I mean they would tie him to the bed with restraints. And if he escaped, which he did a number of times, they would tackle him, sometimes hitting his head. So he was imprisoned, and that would cause anyone a little anxiety, wouldn't it? And they were starving him. They wouldn't give him water. He was begging for water. They wouldn't give it to him. The only reason I saw in the medical record for not giving him water was they were worried about his swallowing until he got examined by this brain dead woman who they probably should have kept her in the hospital for her brain injury because she lacked capacity. She was an idiot. What's her name? Emily Gray. Emily Gray. So she goes and has my son brush his teeth, and he's drugged out of his mind by them. He didn't want to be drugged. They were drugging him against his will. And she has him brush his teeth. And then she gives him a little cup of water to rinse with. One of those little tiny ones you give to like your kids. I can't do that with my fingers in this. Okay, little tiny cup, this big, full of water. And she tells him that they had broken I'm going to use the word broke his eardrum, but that's not exactly what it was. They dislocated the oscillator chain in his ear, in his left ear, during one of their struggles. And so he's newly deaf. He has aphasia, which could result from a head injury, but it definitely got exacerbated by being drugged with drugs that on the label say could cause slurring, other things. So it's definitely was worse. I mean, you could tell when he got home, he got better real quick. Not perfect, but he got better. So anyways, she gives him this little cup of water and he swishes it around in his mouth. And then he looks at everybody and then he swallows it. He was so thirsty that he's like swallowing toothpaste water. And then this Emily Gray writes a note that, he's incapacitated because he doesn't know how to spit water out. Okay, I get to cuss. You fucking moron. Emily Gray, SSP, I forget all of her letters she has behind her names. She's a speech therapist. You are a fucking moron. How is that for speech? Okay. That was a little more than I wanted to say, but I'm going to leave it at that. Hopefully the medicines will kick in and I could take a nice little nap.